Let's now look at how MIH data will be reported by giving a brief overview of MACPRO and the state roles for quality measures. MACPRO is a web-based system for the submission, review, and management of Medicaid and CHIP initiatives such as quality measurement reporting and state plan amendments. For some applications, MACPRO will be a new online submission tool. For others, it will be a change from what was a manual workflow to an electronic workflow. And for some, it will be the first time information is collected. MACPRO replaces CARTS for quality measures reporting. MACPRO is also the system for reporting developmental measures as part of the Maternal and Infant Health Initiative, including under the Adult Medicaid Quality, Improving Maternal and Infant Health Outcomes in Medicaid and CHIP grant. MACPRO is being implemented to improve the state reporting and federal review processes, program management, and transparency. Both CMS and states will know where a submission resides, when the CMS response is due, and the status of the review. Additionally, MACPRO supports data-driven decision-making for Medicaid and CHIP programs. A number of distinct roles have been established for states within MACPRO. These roles determine in what capacity a user will employ the system. It's important to note that the user roles in MACPRO differ from those that are used in CMS's other web-based systems, and in some applications, this is the first time that there are roles being utilized. Let's discuss the quality measure roles and recommendations for who should hold each type of role. This slide lists the 4 quality measures roles for state users. The state editor is responsible for building a quality measures report. The state point of contact, also known as the SPOC, is responsible for reviewing and editing a quality measures report. The state director conducts the final review of the quality measures report, certifies the report, and submits the report to CMS. And the state system administrator, also known as the state admin, is an administrative role that approves and modifies state user roles. We would like to note that in the initial release, the range of the state admin's activities may be limited. However, it will expand over time. A state user may have more than one role in MACPRO, with the exception of the state system administrator. With this release, individuals with the state system administrator role can only hold that role. It is important to note that all state roles must be filled for proper workflow functionality. Let's now review the state workflow for creating, reviewing, and submitting quality measure reports. Here is a brief overview of the state maternal and infant health developmental measures reporting submission flow. First, the state editor logs into MACPRO, enters the necessary information, and submits the report to the state point of contact for review. Then, the state point of contact, or SPOC, reviews the report. Assuming the SPOC is satisfied with the report and does not wish for the state editor to make detailed edits, the SPOC forwards the report to the state director to review. If the state director agrees with the information, they will certify and submit the report to CMS. If the state director would like changes to be made, they may return the report to the SPOC for further work by denying certification. Here is a more detailed workflow showing the steps to create, review, and submit an MIH quality measure report. We will walk through this process in the system, beginning with the state editor. Let's now move into the MACPRO training environment to begin. Please note that because this is a training environment, you may notice slight cosmetic differences between this demonstration and what you see when you go into MACPRO to submit your quality measures. So we're moving over to the training environment now. And as I mentioned, we're going to get started by logging into MACPRO as a state editor. And again, we are working in the training environment today, and therefore the information that you see during this training is arbitrary information only being used for training purposes. When your state enters your maternal and infant health quality measure information, you should follow the technical specifications for each measure. Additionally, we are going to be using the Commonwealth of Virginia, but this is not a reflection of Virginia or their quality measure information in any way. When you first log into MACPRO, you are taken to your news page. This page operates similarly to a social media platform. You can write a post for your team, send a message to an individual, send a task to an individual, or recognize someone by providing them kudos from the text box located at the top of the page. To begin maternal and infant health reporting, first go to the Actions tab. This is located on the toolbar at the top of the page. As you can see, this page is where MACPRO State Editor users have the opportunity to perform several actions, including creating an Adult Quality Measure Report, a Health Homes Quality Measure Report, a Maternal and Infant Health Quality Measure Report, or a Medicaid and CHIP Child Quality Measure Report. The State Editor also has the option to delete an annual report, generate a MACPRO report, request a MACPRO role, or view the implementation guides. There are two options here, as one is a section for all submission types and one is just for quality measures. Because we are in the training environment, we have the option to create reports within several authorities. This screen that we're looking at now may vary when you log into MACPRO depending on the authorities you indicated within the role request template. For the purpose of this demonstration, we will create a maternal and infant health quality measure report. The steps we will go through today generally apply to all types of quality measure reports with a few minor exceptions. There are demonstrations that walk through how to create the other quality measure reports as part of MACPRO training. The trainings are also recorded for your future reference. So let's get started by selecting Create Maternal and Infant Health Quality Measure Report, which we've already done. And this took us to the CMCS Maternal and Infant Health Initiative Developmental Measures Reporting Template page. As you can see, there is a drop-down option at the top of the page to select the federal fiscal year you'll be reporting on. There is an area for you to indicate if your state is participating in the grant. There are 2 measures listed in the Not Started status. And there are sections to enter delivery system information, external contractor information, and to upload report documents. We first determine which federal fiscal year we will be reporting on, and for this training we will make sure 2015 is selected. And 2015 is the only year that you can select at this point. Next, I'd like to pause to draw your attention to 2 links that may be helpful during the process of completing your quality measure information. These 2 links are located on the upper right side of the page. The first link I'm referring to is the Request Technical Assistance link. This link will allow you to submit a TA request to the CMS Medicaid and CHIP Quality Measures Technical Assistance and Analytic Support Program mailbox. This link should be used for questions related to report content, such as how to develop state rates based on data from multiple data sources, or questions about the measure technical specifications. Questions related to using the system should be directed towards the MACPRO Help Desk. We will go over how to contact the MACPRO Help Desk in more detail at the end of this demonstration. Now let's go through the process of requesting technical assistance, and we will begin by selecting the Request Technical Assistance button. Indicate that yes, you have a technical assistance request for the current year. You may compose your question in the text boxes provided. It will be sent as if it is from your email box, which is the email included in your user profile. Please note these messages go to the MAC Quality TA inbox. You may CC your colleagues using the carbon copy line. For this demo, we will CC the MACPRO Help Desk at macpro_helpdesk@cms.hhs.gov as an example. And if you wish, you may enter multiple email addresses into the CC field. You'll need to separate the email addresses using a comma like you would using Outlook or Gmail. In the subject, we're going to enter Training TA Request because we're using this message as an example. And in the message box, we will enter a brief message indicating our question. Note that there is a 4,000 character limit, and you can track your character usage in gray at the bottom left of the text box in the character counter. For our message, we've used 31 out of 4,000 characters. The next section can be used to indicate whether or not you want technical assistance with reporting this measure in a future year. For the purposes of this demo, we will indicate that no, we do not want technical assistance with reporting this measure in a future year. And now that our TA request is filled out, let's submit our request by selecting Send Request at the bottom right of the page. You will receive an automatic response from the Medicaid CHIP Quality Measures Technical Support and Analytics Support Program mailbox immediately following the submission of your request. Here's an example of that message. The Quality Measures TA team will respond to your request within 5 business days. Again, as a reminder, only submit technical assistance questions through this avenue if they are related to measure content. All questions related to how to use the MAC Pro system should be directed to the MAC Pro Help Desk, which we will review at the end of this training. So now we're going to return to the training environment. And the second link that I'd like to point out at the top right of the page is the View Implementations Guide link. By selecting this, you may download a PDF version of the implementation guide for your reference. The implementation guides are documents that provide specific information on how to complete and review a specific section of MAC Pro. You may also access these implementation guides from the Actions page, like we saw a little bit earlier in this training. Now, let's begin by indicating that yes, our state is participating in the Adult Medicaid Quality, Improving Maternal and Infant Health Outcomes, and Medicaid and CHIP grant. Then be sure to read the important message in bold. Please note that the reporting of the Maternal and Infant Health Initiative Developmental Measure, Use of Contraceptive Methods by Women, is optional, except for states awarded the grant. States participating in the Adult Medicaid Quality, Improving Maternal and Infant Health Outcomes, and Medicaid and CHIP grants must complete this measure. Grantees are encouraged to report on a secondary measure, Use of Contraceptive Methods by Postpartum Women. If not reporting on the secondary measure, the grantee state must still access the screen for this measure and select No to the question, Are you reporting on this measure? And complete the Not Reporting on Measure section. For non-grantee states, both measures are optional. Submission of the Maternal and Infant Health Report is not required. If reporting on one measure only, such as use of contraceptive methods by postpartum women, the state must also access the screen for the other measure which is not being reported, which in this case would be the use of contraceptive methods by women, and select No to the question, Are you reporting on this measure? And complete the Not Reporting on Measure section. Next, let's select the measures we will report on today. You may select multiple measures at once, and we're going to select both use of contraceptive methods by women and use of contraceptive methods by postpartum women. Once we select the measures we will be reporting on, we're going to scroll to the bottom of the page and select Begin Reporting. Fill out the information for the first measure, in this case, use of contraceptive methods by women. This page is dynamic, and more questions will appear as we go along depending on our selections. First, we are asked if we are reporting on this measure. Yes is already selected for us and cannot be changed because this measure is required for MIH grantees. If we had indicated on the previous page that we were not a grantee, we would have had the ability to edit this question and select yes or no. Next is the Status of Data Reported section. To complete this field, select the plus or minus sign on the right side to expand the field. We see that there's a question. What is the status of the data being reported? We are going to answer Final. Each section will require us to expand the field to provide our answer. In order to avoid extra clicking, let's select View All Responses at the top of the page to expand all sections. And the next section we're going to look at is Measurement Specification. The Measurement Specification section is already completed for us, as both Rate 1 and Rate 2 are selected because we are reporting on this measure. We can continue to the next section, which is Data Source. Let's check off administrative data for both Rate 1 and Rate 2. Then indicate the administrative data are coming from MMIS, or the Medicaid Management Information System, for both Rate 1 and Rate 2. I'd like to point out that this section includes checkboxes, and therefore you may select one or more checkboxes at a time. Now we're going to move on to the Date Range section, which is the next section below. All measures reported need to have start and end dates for the measurement period. Be sure to read the directions to ensure you are defining your date range properly. For this training, we will use July 2014 as the start date and July 2015 as the end date. Now, if at some point while you are filling out your report, you want to return to the admin screen, you can do so by going to the bottom of the current page and selecting Save. We encourage you to make sure that you select this so that all of your information is saved. The system does not automatically save your entries at this time. Also, please note that clicking Save will take you back to the top of the page and minimize all of your open sections. However, as you see, by expanding some of these fields, our entries are still in place. We can now return to the MIH reporting admin screen by selecting the Go to Admin Screen button at the bottom of the page. As you see here, you can look at the other core measures available. Additionally, the use of contraceptive methods by women measure is currently listed as in progress because we began filling in the required information. However, we did not fill in all the required information or validate our answers. When you'd like to return to the two measures, you can do so by checking the boxes again and reselecting Begin Reporting at the bottom of the page. This returns us to the use of contraceptive methods by women measure we were previously working on. So let's continue by first selecting View All Responses. Remember, we don't like to have to click to open every section, so this is a way to keep yourself efficient. Then we can return to where we left off at the definition of population included in the measure. First, we will define the denominator. For this training, let's select Denominator Includes Medicaid Population. Next, we are going to indicate that yes, the denominator does represent your total measure eligible population as defined by the technical specifications for this measure. Then we will select the delivery systems represented in the denominator. As you'll read in the instructions in gray, you must select at least one delivery system that applies to your state. For each delivery system selected, enter the percentage of the measure eligible population represented by that service delivery system. For this training, we will select Fee for Service and indicate 100%. Again, I would also like to remind everyone that we are using arbitrary information for training purposes, and this is not a reflection of the Commonwealth of Virginia or their quality measures information. Please be sure to follow all technical specifications when completing your state's report. Next is the Performance Measure section, which includes several text boxes. Make note that there is a 2,000 character limit. This character count is tracked for you in gray at the bottom of the text boxes. For this training, we will check off the 15 to 20 age range for rate 1 and include the numerator and denominator. The numerator will be 1,000 and the denominator will be 2,000. Once we click out of the text boxes, the rate is automatically calculated for us. If you do not select an age range, the corresponding text box explaining why the data was not entered is a required field. This is indicated by the red asterisk located at the end of the text describing the text field. All required fields throughout the report have a red asterisk, so use this as a guide while completing these sections. Since we are not checking off the box for the 21 to 44 age range for rate 1, we will include some text explaining why data was not entered for the numerator, denominator, and rate set. As you can see, as we type, our character count moves up, and we've used 35 out of 2,000 characters. Now we're going to repeat these steps for rate 2, but this time we're going to select both age range 15 through 20 and 21 through 44. And our numerators are going to be 1,000. Our denominators will be 3,000. And once we click out of the text field, you'll see that our rate is automatically calculated. We're going to enter in the same information for ages 21 through 44. Again, this is arbitrary information only being used for training purposes. And as Margot from Mathematica mentioned, please be sure to double check the data that's being entered. Now let's continue to the Deviations from Measurement Specifications section. There is only one question for rate 1 and rate 2. Did your calculation of the measure deviate from the measure specification in any way? Indicate no, our calculations of the measure did not deviate from the measure specifications in any way for both rate 1 and rate 2. As you can see, the next section is the combined rates for multiple reporting units section. For the purpose of this training, we will indicate that we did not combine rates for multiple reporting units in both Rate 1 and Rate 2. The next two sections are optional. Note that there is not a red asterisk in these areas. The first section is your opportunity to provide CMS additional notes. This is an optional field and is indicated as such. The next section is the optional measure stratification, and as the title suggests, it is also an optional field. Let's include optional measure stratification for geography. We have the ability to select urban, rural, or add additional geographical regions. Let's select rural. Automatically, we are offered the option of reporting on 2 age ranges for both Rate 1 and Rate 2. We also have the ability to create an additional or alternative classification or subcategory. Let's select the blue link below the table called Additional Alternative Classifications or Subcategory. Then, our alternative classification will be age range 18 through 25. Our numerator is 100. Our denominator is 1,000. And our rate will auto-calculate once we exit the text box. For Rate 2, let's add information in age range 15 through 20. Our numerator will be 100, and our denominator will be 10,000. Again, if we click out of the text box, the rate will automatically calculate. Next, let's add an additional geographical region by selecting the blue link below the table named Additional Geographical Regions. We can define the geographical location as suburban. Once we click out of the text field, our numerator, denominator, and rate set boxes appear. Then let's report on age range 21 through 44 for Rate 1 and Rate 2. Our numerator will be 1,000, and our denominators will be 10,000. Our rates will automatically calculate both times. Again, these are arbitrary numbers being used for training purposes only, and be sure to follow all technical specifications when completing your state's report. Next is a section where we can add documents to the report. We will do this at the end prior to submitting for review. However, you do have the option to upload documents to the report within this section. The final question within this measure is if we would like to validate the core measure data at this time. The measure does not need to be validated at this time to proceed, but it must be validated for the measure to be marked as complete. All core set measures must be complete to submit the report to CMS. For this training, we will select Yes, validate the core measure data at this time. Now that we selected Yes, validate the core measure report, there is a note below indicating that if validation fails, errors will appear in red above. Validation ensures that information is fully filled out within the report. If there is a field that is missing the required information, the system will indicate what information is required in red prior to allowing you to complete the core set measure. Let's now move on to the next measure by clicking Go to Next Measure. Since there were no error messages, we were able to continue to the next measure. We are not reporting on this measure, so let's begin by selecting No. Now there are a series of checkboxes presented for you to explain why you are not reporting on this measure. You must select at least one, but you may select all that apply. For this training, let's select Service Not Covered and Data Not Available. Next, we are prompted to explain why the data are not available. We are going to indicate that the information was not collected and that the data were not collected by the provider. If you have any report documents to upload, you may upload them below. You may also upload documents to the report from the admin screen. We will upload a document as an example from the admin page before submitting our report for review. Next, indicate that yes, we would like to validate the core measure data at this time, and select Go to Admin Screen. As you can see on the screen, the status of the measures are now complete, and there is a green check mark to the right of the status. Now, if at some point you need to access reports that you are in the process of working on, you're able to do so by going to Records on the upper toolbar. Select Maternal and Infant Health Quality Measures, and select the report that we just created. As you can see, it says we created this a moment ago. Because this is a training environment, there are several reports included in this area. In this case, our package ID is VA 2015 MIH 985. The package ID consists of the state or territory abbreviation for the report, the year, the type of report, in this case MIH quality measure, and a MAC Pro generated number. If you select the link to the report record, it will take you to the report summary screen with a timeline indicating the stage in the process the report is in. It includes report information, SPOC or state point of contact information, and audit information. You'll notice on the left side of the page, you also have the option to view news related to this report, related actions, report data, and a consolidated view. If there were multiple versions of the report, you could view older versions of the report here as well. To continue modifying this report, select the Modify MIH Quality Measure button in the top right-hand corner. As you can see, this takes us back to the admin page for the MIH Quality Measure report we were working on. Next, let's complete the delivery system information by indicating the percentage of enrollees that were in each delivery system. For this training, we will assume all enrollees were in the fee-for-service delivery system by indicating 100%. And we did this for both age ranges 15 to 20 and 21 through 45. Again, this is not a reflection of the state of Virginia or their quality measures information, but is arbitrary information that is being included in this training environment for training purposes only. Be sure to follow all technical specifications when completing your state's report. Next, select whether your state obtained assistance from one or more external contractors in collecting, calculating, and/or reporting your core set data. You must select at least one option, you may select at least one option. And in this case, we're going to enter none of the above. We calculated all the measures internally. So you may update this portion of the report prior to sending the report to the state point of contact for review or throughout your process of completing the measures. As a note, be sure to select Begin Report or Request State POC Review, whichever is appropriate for your situation, after completing this information to ensure that it is saved to the report. Next, you may upload accompanying report documents. You can upload a maximum of 84 documents to a report and a maximum file size of 2 megabytes. You may upload PDFs, PowerPoints, Word documents, and/or Excel spreadsheets. We will upload 2 PDF documents for this training. First, we will select Browse. Then we're going to select our first test document for this training. These are just dummy documents that we put together ahead of time. Then you need to enter your description. This description will show up in the table above, so that way you can remember what your document is that you put in here if it's not completely obvious by the file name. Sometimes if there's a save in progress, you're going to have to click the refresh button to get back to that page. If you have trouble in that section, you can feel free to reach out to the MAC Pro help desk. We're going to upload our second test document, which again, this is just a dummy document made for training purposes. Once that's in there, we're going to add another description. And again, this is just something to give you another bit of a hint of what your document is, so you don't have to open it every time if you have several documents included in this table. You can have up to 84 documents uploaded into your quality measure information. You are able to sort documents that were uploaded by clicking on a column header. A red arrow will appear to indicate the column header that the documents are being sorted by, as well as whether they are being sorted in an ascending or descending order. As a quick note, you may upload documents from a core set measure screen as well as from this administrative screen, which is centrally located at the bottom of the page. All uploaded documents are uploaded to the report in general and are not specifically uploaded to core set pages. If at some point you want to delete a file, you may check the box next to the file and select Delete Document. For this training, we will not delete any files. At this point, we are ready to request the State POC review of the 2015 MIH Quality Measure Report. We will do so by selecting the green button at the bottom of the page. This takes us to the report summary dashboard for this report. And as you can see on the timeline, the report is now in review. Additionally, there is no longer an option to modify your report in the upper right corner, like there was earlier in this training demonstration. The state point of contact received a notification in their email box and a task in Mac Pro indicating that their review was requested for this report. You will not be able to edit this report as the state editor again unless the state point of contact returns the report to you. Now let's return to the PowerPoint to review what we have done thus far and what the next steps are. So if you review the steps we just covered, you will see in the first row that first we logged into Mac Pro as the state editor. We selected the Actions tab along the top bar, then clicked the Create option for maternal and infant health quality measure reporting. Next, we selected the federal fiscal year of interest, the measures we would report on, and we began filling out the needed information. When we finished entering the information, we chose to validate the data. When everything was entered, we selected Request SPOC or State Point of Contact Review to complete the process. At this point, let's take a couple of minutes to answer any questions. Could the operator please open the line for Q&A?